It's really hard to believe that it's just over 3 years since we first heard that term coronavirus, which subsequently went on to be called COVID-19. So much has happened in that time, and there really is so much that hospital staff can be proud of in terms of their contribution throughout that whole period. Hospital staff played a really important role in ensuring that patient care continued to be delivered on all of our sites. Patients were looked after in hospitals throughout that whole time, regardless of their needs. But hospital staff can also be really proud of their contribution in the communities. We played a really important role in the rollout of the vaccination programme across the region, both in the mass vaccination centres but also in the long-term care facilities. And actually, hospital staff also played a really important role in ensuring that residents in long-term care facilities were kept safe throughout that period as well. Largely because of the efforts of our hospital staff, we've now moved on, and COVID-19 isn't the threat that it used to be. And so we've shifted our focus back onto more familiar challenges such as patients awaiting admission on trolleys and waiting lists. But there are lessons that we've learned throughout COVID-19 that can help us through those challenges as well, particularly around integrating our work with the work of other healthcare professionals in the community and working together in order to provide the best care that we can for the people living in our region.
I'd like to acknowledge all the staff who've come in, day out over the last 3 years. Despite the challenges associated with COVID, we've achieved a lot, and it's really important to acknowledge it.
Delivering patient care throughout a pandemic has been extremely challenging across all of our hospitals, and I want to start by acknowledging the amazing commitment of all of our staff throughout the last number of years working through COVID-19. I would ask you to take time to think about your contribution to this amazing national effort in meeting the needs of patient care through the pandemic, and to acknowledge the work of your team members, those in your hospital and across the hospital group. COVID-19 has had a really difficult impact on the delivery of elective care across our hospitals. But despite the constant threat from COVID-19, all of our sites have delivered elective care to patients at every available opportunity. There have been significant infrastructure developments across all of our hospitals. We have developed a temporary ED in UHG and an ED extension in Sligo. We've also created additional ICU capacity with an ICU extension in Sligo. And there are a number of ward block developments being progressed currently, one in Portiuncula and the second in Sligo. But we've also created additional beds on our sites, particularly in Letterkenny and in Mayo, utilising a community facility to repurpose for acute hospital beds. In Roscommon, we've developed the Palliative Care Support Unit, which has opened this year. We know that we need to continue to build capacity across all of our sites to support our emergency activity, our elective activity, and our cancer activity. And we will continue to advocate for and progress projects to create additional ward capacity, additional support services capacity, and additional ED capacity to support patient care.